Okay. I started with the lechely concept on solids. For those of you who don't know, the lechely has 10 principles about breastfeeding and mothering. And the one that relates to starting solid foods is this. For the healthy full-term baby, breast milk is the only food necessary until baby shows signs of needing solids about the middle of the first year after birth. Okay, now I color-coded it before. It was originally on one slide. Because there are 3 elements that that have not changed since 1981 when this concept was finalized. Breast milk is the only food necessary. That means no other fluids or solids until the baby shows signs of needing solids, which so some may be ready early, some may be ready later, some might not even be ready for a year. But it's an individual thing. Every baby is different. And the last part, about the middle of the first year. So the average age of readiness is around 6 months. So when everyone agrees about this controversy I'm going to be speaking about what is the appropriate age for children to begin complementary foods, everyone agrees about the first 2. That exclusive breastfeeding should be in the early months. And everyone agrees that every baby is different, and some babies need to start earlier, and some babies might start later. But the controversy is that 6 months. So I'm going to talk about the different groups who have advocated either 4 to 6 months or 6 months, and what their reasoning is. Okay, so I'm next. Okay. First, in general terms, like I said, we know we shouldn't start. We know that the baby in the beginning should be exclusively breastfed. So here are the reasons that it's too the risks from maybe starting too early. Breast milk could be displaced by lower quality food. We know that breast milk has high quality fats, proteins, carbohydrates. It has vitamins and minerals, and sometimes the food that the baby is getting might be lower in calories, like fruits and vegetables, or it might be refined food, and the baby won't get what he needs. So continuing to breastfeed will ensure that he'll get those things. Now, okay, so and again, if the baby's getting solid, so he might not grow well. Okay, also, young babies are not able to digest certain foods. When you have a young baby who's getting additional food besides breast milk, it might be contaminated. The breast milk is always straight from the source, but with if the food is not prepared properly, there might then the baby could get sick. And with a young baby, it's much more of a concern. An older baby is also going to have a risk of contaminants, but it's not going to be as risky for him. Okay, allergies. Now, I'm not going to talk a lot about allergies today. I'm just going to say that the consensus right now is that introducing allergenic foods to newborns is a problem. But the research now is indicating that after 4 months, babies, there's not an advantage to waiting longer than 4 months in order to give babies allergenic foods, even babies who are from families with a history of allergies. So, so it seems that the 4-month recommendation doesn't seem to increase the risk of allergies. There are other issues with it, as I'll discuss later, but we're going to pass over on that now. Okay, and early return to fertility for mothers, which I'll mention later. Okay, now what's the problem with waiting too long? If breast milk is good, what can happen if the baby continues to be exclusively breastfed for a very long periods? So at some point, there will be growth faltering. The baby will might stop gaining weight or stop growing in height. Okay, lack of micronutrients, especially iron and zinc. So baby has an iron, they have stores from birth, from the blood of the mother. Breast milk is low in iron, and at around somewhere in the middle of the first year, the baby needs additional iron from food. Okay, and waiting too long may interfere with optimal development of oral motor skills. There's an age where the baby is ready. He wants to put things in his mouth. He knows his cheeks and his mouth develop to handle solids and to swallow them. And that's when and it could be that if there's some indication that if we wait too long, that the baby will develop aversions to to solid foods. Okay, other things that happen at this age: eye-hand coordination, social skills, mother-baby interaction, getting used to tastes and textures. And again, we're not talking about those babies who refuse solids until a year or longer. Okay, so these are all genuine concerns. Okay, so everyone agrees again that before 4 months is too early. And everyone also pretty much agrees that the recommendation should not be later than 6 months. No one is saying wait till 7 months to give solid foods. So, again, except for an individual baby. Okay. So where is the border? The question is, what's the border? When we're making a public recommendation, we have to have a public health recommendation. We can't, even though ideally we should look at every baby, there still needs to be some kind of guideline. And the question is, what is the borderline? When does the risk of introducing new foods to the baby outweigh the benefits? And for every baby, there's a different point. But we still have to have a public health recommendation. Okay, so here are the recommendations. All right. In 1981, the World Health Organization they began to recommend exclusive breastfeeding with introduction of complementary foods from 4 to 6 months. Now there was a question of, so when did babies get solid foods at that age? According to the head of the Committee of Nutrition of the AAP, the norm was 1 month. We looked Ellen Longman looked up for me and Dr. Spock from 1976, and he says that many doctors recommend from 2 to 4 months. And again, I'm sorry, I don't have his name, but the director of the AAP, of the the Committee on Nutrition for the AAP said we have to go stepwise. It's too extreme to go straight to 6 months. And there's also an awareness for formula-fed babies that there could be missing ingredients. In the late 70s, there was a scandal by the formula company Syntex with 20,000 babies were fed a formula missing chloride. And some babies were brain damaged. So one of the problems with the recommendations is that they apply both to breastfed and formula-fed babies, and that doesn't necessarily work. So the missing ingredients is a reason that the 4-month recommendation is often there. Okay, let me see. All right, let me just explain who these different people are. So the World Health Organization, we all know, I hope, 1981. 2001, they went to a full 6 months. In 2006, UTUNET is the European Union. Just a second. The European Network for Public Health and Nutrition. The lead doctor was Dr. Adriano Cataneo from Trieste, Italy. And they went along with the full 6 months. Not every country in Europe follows it, but that's the European Union's recommendation. Okay. Yes?
Are any of the guidelines talking about sitting up versus not sitting up?
Yes, we'll get to that. Okay. In 2008, the ESPGHAN, which are the this is a European group of gastrointestinal specialists. They make the strongest case for between 4 and 6 months, and I'm going to go into more detail about that. Now, And in Israel in 2009, rewrote their recommendations based on the SPGAN recommendations, and that's why they put in all of that about 4 to 6 months, which I'm also going to look at in a couple of slides. Okay. And it also could be related to the Remedia scandal, because there were also missing ingredients, and we know the babies who had Remedia, who also either nursed a little bit, or had some bamba, or had something, did better than the ones who only had the Remedia, which was missing B1. That was in 2003. And 3 babies died because of a formula, soy formula imported from Germany, made by Humana. And these babies, so even the, so again, there is that issue of missing ingredients. Okay. Is there a question? All right. Okay, and I just put up the AAP recommendation. The AAP in 2011, they put out their statement in Pediatrics magazine, and they reiterated 6 full months without any caveats. Okay. The American Association of Pediatricians in the United States. Whoops, I skipped one. Okay, SPGAN. Here they are, European Society for Pediatric Gastroenterology, Hepatology, and Nutrition, and they sparked the controversy. Okay, so what are their guidelines? First of all, they recommend complementary foods between 17 and 26 weeks. Now, they don't write that all babies should start at 4 months, but Okay, excuse me, I'm backtracking. They were attacked by Cattaneo, an Italian pediatrician who headed the U2Net, the European Union's recommendations before, and by Maureen Minchin, who is the Australian author of the book Breastfeeding Matters. Okay, and what does the Israeli Health Ministry say? They say exclusive or nearly exclusive breastfeeding for 6 months, but then they say to start taste between 4 to 6 months. However, they have many conditions. So they don't say all babies should start at 4 months, but this is the impression that parents are getting, and perhaps in some Tipat Chalav clinics, in well baby clinics, they are telling mothers that they should start at 4 to 6 months. But the actual guidelines say that when the baby is ready. So the conditions that are listed according to the health ministry, that the baby can sit up without support, doesn't have to be sitting up completely on his own. He moves his tongue from side to side, he can bring objects to his mouth, and he shows interest. And taste should only be up to 2 teaspoons a day. I did an informal Facebook survey, and most mothers reported that they were told to start at 4 months, and some of them also knew that it shouldn't be more than 2 teaspoons. Okay, but no one got the message that not all babies are ready at 4 months. Although, except unless their baby wasn't, and then maybe they waited. Okay. So really, it's rare to be ready at 4 months. All right, let's go on. Now, what can the studies tell us? So now I'm going to talk a little bit about a summary of the different issues. Again, not all of the issues about when to start complementary foods, but specific issues about when there's a difference, or there's a question about whether it should be at 4 months or between 4 to 6 months or 6 full months. Okay, so the highest level of evidence in clinical study is random controlled trial. To do this, for this topic, you would need to take a group of babies, divide them randomly into 2 groups. Both groups would have to be fully breastfed. Then you would start one group at solids at 4 months or 5 months, and the other group you would wait a full 6 months, and then you would compare and you would see what the outcome was. Okay, so there are very few studies, but there are more being done right now, so in light of this controversy. So we'll be seeing more data about it. Okay, so mostly we have observational studies where we looked at when the baby started solids and when they developed illness or anemia. But we don't know why the baby started early. If the baby was fat and healthy, he's much less likely to have gotten complementary foods. So that might affect the results. Okay, also the definitions of breastfeeding, whether full or exclusive, they differ across studies. And also there may be babies who the mother reports that they're exclusively breastfed, but they really got a formula earlier, even right after birth, and sometimes that can affect some of the outcomes. Okay. All right, Maureen Minchin, I mentioned her, she's from Australia. I got interested in this topic. I suggested to speak on this topic because I heard 2 lectures at the online Gold Conference last year, and one was by Maureen Minchin. So she said that history and common sense teach us that 4 months is too early. Why? Until about 1900, babies were exclusively breastfed for 12 months or so, and that was pretty much the norm. Maybe there weren't so many options for feeding solid foods. For poor families, it was a form of nutritional insurance to keep the baby breastfed in case times were hard. But it's still, most babies did quite well for going longer. Okay, often the babies were healthy, but the mothers were undernourished. Okay, and the common sense is that most babies are not ready for solids at 4 months, and if you look at the different developmental signs that are mentioned, they happen between 5 and 7 months and not at 4 months. Okay. Okay, where's the money? There is a financial interest in recommending that babies get complementary foods at 4 months. They're less likely to have table foods that the mother can prepare at home. They're more likely to need to use commercial food or jars, and you can sell more baby food if you can put that it's safe for babies from 4 months instead of just for 6 months. Then you can sell a lot more baby food. So Dr. Cattaneo, the other lecturer I heard, he's from Italy. He pointed out that the Espigón report says that the conflict of interest statements are available upon request. They're not directly in the recommendations where they should be. It says you have to ask, you have to write away and ask for them. And if you Dr. Agostini, who headed the Espigón report, he's received fees from Nestle, Humana, and many other baby food companies. Agostini was the lead.
He's the one that recommended the 4 months?
Yes, he's the head of the Espigón. Yeah, sorry. Okay. Okay, so now I'm going to go over the different controversies, the specific issues. Okay, infections. This is actually a very big reason for recommending waiting until 6 months. Infections of the gastrointestinal tract were more among those who are only partially breastfed at 3 to 4 months than 6 months. After 6 months, it doesn't seem to be as protective anymore. If the mother is partially breastfeeding, if the baby is getting solid foods, that's protective against the infections, but it seems that starting solid foods between 4 and 6 months does increase the risk for gastrointestinal infections. Okay, some studies compare babies who wean completely who were partially bottle fed. Okay. That was a Cochrane review of studies who compared the babies who started complementary foods at 4 to 5 months versus those who started at 6. They looked at several studies and they showed this conclusion. All right. Celiac disease. Okay, this is the one that was mentioned most frequently. It's mentioned in the Israeli Health Ministry decision. There's a 53% reduction in celiac disease when gluten is introduced during the breastfeeding period. So it's not that it's not a question like with the infections of the age of the baby. It's a question of, is the mother still breastfeeding? And the mother is more likely to be breastfeeding at 4 months than at 6 months, just because there's a certain number of babies who are going to wean in that period. So the health ministry said, let's make sure that all these babies get some gluten at 4 months, and maybe then we'll stop some of them from getting They're testing them. They're looking at babies who were actually tested. They tested the babies to see if your friends were not tested when they were infants.
Right, but it changed the numbers. All the people
they're talking about the babies now. Now they have very good tests, and they looked at these infants and they saw what their diet was, and they saw which of them had celiac and which ones didn't. Now, 1 to 3% of the population has a genetic predisposition, but all babies will benefit, in theory, from nursing longer. So it's a question of whether this group also. Maybe perhaps if there's an issue of gluten, the baby should be encouraged to breastfeed longer instead of starting of being exposed to gluten.
And being exposed to gluten later in life.
Well, there's a lot of evidence that it does hold off or prevent celiac disease to offer them gluten or when they're still breastfeeding. And not to offer it at all.
Yeah, but the older the baby is or the child is, toddler is, when being offered gluten the first time, the possibility to get the celiac will be less. If it's still
not necessarily. It could be that there's a certain point. It could be that there's a certain point where it's not. I'm not sure about that. Okay. Okay, next.
Because there's some antibodies that are, the antibodies that we're getting in the milk that helps them with the gluten or what?
Yes, there's a biological advantage. The breastfeeding helps mediate, the breast milk helps mediate the gluten substances and help the body tolerate it. And it's possible that there are other allergenic substances that are also, that's why breastfeeding babies have fewer allergies in general, because the immunological properties of breast milk help mediate the response. Okay, next. Iron deficiency anemia. Okay. All right, this is a big one. It's a main reason given for starting complementary foods. As I said before, the baby's iron stores will diminish, and breast milk is low in iron. So it's very important that the baby, when he is getting complementary foods, that he gets foods that are high in iron. At least, the health ministry says at least 1 iron-rich meal a day. Okay. So so we know, okay, some foods that are early, like pears, actually interfere with the absorption of iron from human milk. I looked at, someone asked me for the resource, I mentioned it before. Pears, look up, the name is OSKI, O-S-K-I. There's a study, Agasim, yes. And that's, of course, we know that pears are very commonly, it's a mild fruit, and it's commonly given to babies. So Israel has a high rate of iron deficiency anemia, especially in the non-Jewish and the Haredi populations. Poor diet in the second half of the first year can be is usually related to anemia. The risk is very low, though, in fully breastfed babies for the first 6 months. The problems tend to start in the second half of the first year. And there's iron drops in fully breastfed babies lower the protection of the immune system because the excess iron cannot bind to the lactoferrin. So the iron serves as bacteria. The extra iron might serve as food for bacteria. So there are different ways of approaching this issue. It's a serious issue, and there is a fear that there are some breastfed babies who might start to have low iron already before the 6 months are over. So the European Union's recommendations in 2006 were that to make sure the mothers get enough iron during pregnancy and lactation. It's a question of, that's one. The WHO review in 2002 said to give iron supplements to vulnerable babies. Here in Israel, they give to all babies. The recommendation is to give preventative iron to all babies starting from 4 months. Okay, another option is to delay cord clamping after birth for 1 to 3 minutes to allow the baby to get more cord blood, and that may also have an effect. Okay, in Israel, we think of it, or in Western countries, we sometimes think of it as an inconvenience if the menses return because birth control is so available. But a lot of women don't use it, and it's a public health issue. not only in terms of, overpopulation and all that, just in terms of close pregnancies, since close pregnancies lead to early weaning and higher risk of miscarriage or prematurity for the next baby. So it puts both the nursing baby and the fetus at risk to have closer pregnancies. So if the mother is nursing longer and exclusively, then then she's less likely to get pregnant. So the small and gradual feeding of solid foods to babies will help delay the return of menses. Checking the timer. Okay. Okay. Now here's another interesting question that was raised by the Espighan report. Is formula a complementary food? Okay, so.
In Hebrew, it's very easy. It's mutzakim.
Okay, but that's the wrong answer. Okay, so the Espighan report, those were the GI doctors who are in favor of 4 to 6 months of They object to the WHO's definition of formula as a complementary food. The WHO, the World Health Organization, says the answer to this question is yes. And I'll explain why. Okay, so the Espighan says, the WHO, the World Health Organization. Now, the Espighan, they said, but it's given to babies in the early weeks, so it's very confusing. And of course, sometimes it's necessary and it's, you don't have a choice, but still. Maureen Minchin points out that infant formula contains sources from animals, including cows and fish, and from a variety of vegetables, including allergens, and even perhaps peanuts in the past. And so that's why it's really a mixed food. Okay, it's not, human milk doesn't have any complex carbohydrates that are hard to digest. But many formulas do. And also formula is not uniform. Every company makes it slightly differently. So we don't know different types of fats, percentages of fats, proteins, carbohydrates, and even with labels, sometimes the labels are identical. Or there was a story in Australia on a product review site. They began posting messages about Nestle Nan HA1 Gold formula. They said that all of a sudden their babies had these symptoms. Dark green, watery poo, vomiting, rashes, and dehydration. And it turns out that the company changed the formula. They replaced calcium chloride. They replaced potassium chloride with calcium chloride, and they denied it. So I'll say, give a caveat, I don't know if that's really what happened. I don't know. But that's what the news report suggested, that this was related. And so for all intensive purposes, formula can be thought of as a complementary food. Okay. Next. All right, we asked about the signs of readiness. We just have the opinion of 2 doctors. Dr. Adriano I mentioned before from the U2Net. When the baby reaches for food and eats it, that's when he's ready. Even prior to, he said, even there might be a few outliers who are prior to 4 months. That's what he said in the Gold Lecture. And Dr. Jack Newman says exactly the same thing, when the baby reaches for food and eats it. But he said that if it's much sooner than 5 months, check that the baby is getting enough breast milk. Because he comes across a lot. I actually met him in Medellin, Colombia, and I interviewed him about this. He said that if that the baby is, he hears from a lot of mothers whose milk supply drops after 4 months. And if that's the case, the best thing is to try to get the milk supply back up. And but if that doesn't work, then solids might be indicated. Okay. Oh, there's some advantages to letting the baby decide that he's ready to eat. First of all, you know that he's developmentally ready if he can do it. He won't overeat. He can choose how much and what type of food. That's why it's better to put a few different kinds of food on his plate and let him choose instead of mixing it all together and spoon-feeding it to him. He's like everyone else. He's independent, and all babies want to be like their parents. It's totally in his control. And it's a social skill and a neurological skill. Okay, this is my niece, my sister's step-granddaughter, whose name is also Hannah. She lives in Brooklyn. She nursed exclusively for 6 months. And here she is. So I happened to see her a few weeks ago. And here she is. And they just give her everything. She's eating a strawberry. And I think there's some kind of, I don't think it's schnitzel. I think it's some kind of orange vegetable. I'm not sure. But whatever. The point is she sits at the table with everyone else. And they give her the food. And she eats what she wants. 11 months. Okay, what I thought I would do now is I have a few real-life examples of questions that have come up either in Tipat Chalav or in forums or the Letshe League to apply what we've learned here. Okay. So one example, 10-month-old baby, he only wants tastes. He's fully breastfed, and the doctor thinks that the baby should wean. So, wean. Because he's only eating tastes. And the health ministry is saying from 4 months he should be eating. So he's 6 months. At 4 months he should only get tastes. But okay, but this baby is normal. He's assuming he's growing properly, of course. We know he can eat. He can swallow, and if we wean him, we don't know what's going to happen. At least now we know he's getting high quality food. But if he's weaned, anything can happen. Okay, second baby. This baby gained only 400 grams between 3 and 4 months, and everyone got very worried that the baby needs a supplement. But a history of the weight showed that the baby gained 1 kilo each in the first 3 months, and this happy, chubby baby was just slowing down. So some babies who are gaining 400 or 500 grams in 4 or 5 months, that couldn't be normal for them, even if they're dropping in percentiles. But if they look how they look, I always tell the mother, and also take the baby to the doctor, because sometimes the mother's not objective. I mean, and I've had babiys who are underweight.
But then the doctor told her what he told the front.
Okay, well, fine, but right. Well, yes, it's true. The doctor might tell her to wean, but I emphasize that the doctor sees a lot of babies. And if the doctor says the baby is healthy and looks good and is developing normally, then she can relax. But sometimes there are issues. Do you have a question, Edie? Okay. Okay, next baby. A mother on the internet reported that her 8-month-old baby throws up every other day after eating solids. So I suggested that maybe he's getting more than he needs. So she said he eats 150 grams. But she reads about babies who eat 300 grams every meal. So anyway, and why is she measuring? But and perhaps it's just comparing it to formula again, to see how many grams is this baby eating? How many cc's? Okay. So she said the baby didn't sit up yet, and she wasn't sure how she could feed him, but I asked whether she could sit him on her lap and try to give him pieces of food, and so she tried that, and we hope that he won't throw up anymore. Okay, an experienced mother of a 5-month-old, the baby is dropping in percentiles. The mom realized that she was 2 months pregnant, at which point it's very difficult to increase milk supply. So the question here is what the baby should be getting in addition to breast milk, since he's not gaining well. So it's whether formula or solid. So again, if we have the health ministry's guidelines, we can say, that this baby needs solid food at 4 months. 5 months. Okay. Yes?
The guidelines say that his taste at that time. That's not the diet at that time. So
right, I know, but again, if you have... Okay, well, I don't know. You could write to the health ministry and ask them whether you should give formula or whether you should give solid foods, But the point is, if the baby at 4 months is okay, if it's okay for them to be exposed to solids and there's not a risk of allergy, and you have a baby who's underweight, you could give him the formula instead. It's a question. It's not a question. We want to give him the breast milk, but that's not an option here.
The question is if you can realize that they can get enough calories at 5 months from the solids. What would it be like the way
You would have to keep an eye on it. You would have to, if the baby wasn't interested and would only, You'd have to see if the baby was satisfying. Yes?
Isn't there a problem with feeding a baby that can't sit up? You're talking about this baby, I think the example before, at 11 months not sitting up. How is the child supposed to digest?
No, the baby could sit up with support. He just couldn't sit up by himself. And sitting up without support, according to the health ministry, is a sign that the baby is ready. The baby could sit on her lap. He would sit on her lap. He wasn't lying down. She wasn't feeding him lying down.
And a baby that can't sit up shouldn't be fed solids?
No, probably shouldn't be. Probably shouldn't. If a baby can't sit up, no.
Not part of the definition at all.
Although I'm not an expert on this. I'm not an expert on that. I'm not sure. But I wouldn't give a baby who can't sit up food to hold in his hand, and I wouldn't personally. But
But what are they recommending them feeding, like giving the bottles of purees that they used to do all the time?
they're not recommending that. The health ministry is recommending taste on the mother's finger or in a spoon. But
But if the baby's not sitting?
that's a good question. I think there's a contradiction in their recommendations because I think it has to do with the gluten. They want to introduce gluten early, but they don't want to. But they're afraid to say to go against the WHO recommendations.
But the food recommendation is from 6 to 8 months.
No, it's from 6 months. It's 6 months. It's not 6 to 8 months. Yes. Ken, אני אתרגם, כן.
לגבי הספר נכתב שהראה שיש שיעור הזיהומים במערכת העיכול יותר גבוה כשחושפים בין 4 ל-6. זה היה, קודם כל אני יכולה לספר קצת יותר על המחקר הזה, זה מחקר משמעותי ואיך הקהילה...
זה יוקמה. She's asking about the studies on infections, on gastrointestinal infections in babies who started complementary foods early.
והאם זה הייתה רק חשיפה או ממש התחילו בגיל...
I'm not sure. There were few studies. There were few studies that. That's a good question. I'd have to check that. But this is.
האם מישהו בדק, האם יש קשר בין אורך תקופת ההנקה לבין מתי הם מתחילים מוצקים? זאת אומרת, האם העובדה שנגיד מתחילים ללמוד בגיל 4 חודשים, זה אומר שהתינוקות האלה יונקים פחות זמן לאורך כל תקופת ההנקה? יש לזה השפעה? כן.
We see the mothers who are starting early, and they're asking when can they switch to replacing a breastfeeding. You know, when can they make this a whole meal? Very anxious. And in my next case here, we have a baby. The mother weaned the baby from the breast. She was only nursing once or twice a day, or only at night. Baby was 8 months old, and he was getting only solids. He wasn't getting any formula. Baby did not gain anything between 8 and 12 months. So we don't know if that's related to early solids or not. But the mothers, once they start solids, there is certainly in our culture there's the implication that it's going to be replacing breastfeeding. So if we can, so it is a factor. But I didn't come across, when I did the research, I didn't come across a study that specifically asked that question. Okay, the baby, also Dr. Carlos Gonzalez in his book, My Baby Won't Eat, he points out that between 6 and 12 months, babies should be getting about 500 milliliters of milk. And that's not enough. 1 or 2 nursings, it's going to be very hard to get 500 cc's from 1 or 2 nursings a day. And a lot of mothers are confused about it. Some do give bottles, and some just replace with solids. And the milk is important. Okay. All right. I'm almost finished. Okay, another example. The mother's returning to work, and she can't pump enough, or she doesn't want to. English.
I see a lot of mothers going back to work. First of all, I live on kibbutz, so I see even within the kibbutz when they go back to work, even physically, they're not so far away. And now specifically close to me, my daughter-in-law, and I remember when I was raising my kids that there's very around 5 to 10 months of the transition from a breastfeeding baby to really getting enough nutrition from other foods. And also the issue of what to give if they can't, if the mother is having trouble pumping enough or something like that. Because if they try the formula and the baby has a really bad reaction to it, then there's really a problem here. And I think there's not enough, I don't know, not enough support for the period itself as being difficult and what to do with it. And also the question that I raise again is, if formula at this point for a baby that's basically still breastfeeding, somewhat, even, you know, and if formula is even better than just plain cow's milk, you have to give.
Right, that's another question, right? Whether
for years, I mean, you know, it may be that cow's milk is just as good if the baby's also breastfeeding.
right. So the more the baby is breastfeeding, the more leeway you have to see if solid foods will work for that baby. You know, if it's a question of one feeding, if it's 3 feedings, then maybe you wouldn't want to go to 3 solid feedings at, you know, at 4 or 5 months.
Let me just say what I'm saying. Because cow's milk, okay, cow's milk has the basis of the problem in cow's milk allergies. The formula has fruit because it's based on cow's milk. But cow's milk doesn't have all the allergens in it. What did I say? Some allergens today, some junk food. But
Okay.
formula is really a junk food.
Right, so a lot of mothers who formula feed go to cow's milk earlier than the recommendations because of financial reasons. And also Dr. Jack Newman, I'll quote him, he says after 6 months, you know, if the baby doesn't need formula and should be able to get a diet from, yes, but again, that's not what the official guidelines are. Okay, but it is a question again, and if, all right. Okay, one more example, and then I'll stop. The baby started solids, and he was very constipated, even though he was older than 6 months. But so the nurse recommended stopping solids to see if it would go away, and it did. So even though the baby was older 6 months, his digestive system still wasn't ready for solids, and he needed to take it more slowly. Okay, so are there any more questions? I'll be happy to answer. It's lunchtime.
Do we know something about saliva and readiness for solids?
I do not.
And sorry, if I hear the other
She asked about saliva. There's the relationship between saliva and readiness for solids.
milk of the mango. I'm meeting people that are giving their children as not to give them formula.
Okay, it says that very clearly in the health ministry guidelines that almond milk and other coconut milk are not substitutes for formula, cow's milk, or breast milk. So that's what you can tell them.
But then if the baby is older than 4 months, then it could be.
Even so, but that's not it's a juice. It's not recommended for babies.
שמחה שישבת